Grief is a very personal and normal reaction to losing someone. But how long should it last? And how do you know when you're stuck in it and you should look to get help? That's what I'm talking about today. I'm Dr. Tracey Marks, a psychiatrist, and I make mental health education videos. There's a few models of how grief usually plays out in people. The most common trajectory is where you have high levels of grief immediately following the loss, and then a continuous low levels of grief that get better over the years. Typically, the first year is the hardest because of the anniversary reactions. You can have an uptick in your negative emotions or longing about the person around important dates like the person's birthday and holidays. And then the big one is the anniversary of their death. Sometimes these important date reactions can catch you off guard. You can start feeling sad or start thinking a lot about the person days or weeks before the upcoming date. And because it's days before the date, you may not make the association that you're feeling this way or thinking a lot about the person because this significant date is coming up. And everyone's different, but I've seen that often after you get through a year of the dates, the second time around of the dates is a little easier. And there may be even some minor dates that you miss and aren't as difficult. And when I say easier, I don't mean that you won't be sad anymore, but that your grief will be less consuming and you'll have more of a balance between happy and dark thoughts when you're reminded of your loved one. A good place to get is when you think of the person that you lost, you still miss them, but the predominant thoughts that you have are positive memories. Another trajectory is remaining in shock and disbelief for a while and then slowly experiencing the emotional loss. You have a delayed response. And you may experience a lower level of negative emotions initially, but then later on, it seems like everyone else is moving on and you're just getting started. And some people can feel very alone with this course because you're late to the game and you don't have other people to share your level of grief. Other people around you saw you handling things well at the beginning and can't understand why you're now getting worse. Prolonged grief, which some people will refer to as complicated grief, is not an official diagnostic term in our psychiatric manual, but it is listed as a disorder in the International Classification of Diseases Manual, and it's gaining more and more ground as a focus of clinical attention. We consider grief to be prolonged and complicated when it has certain characteristics and lasts for more than a year in adults and 6 months in children. One sign that you have complicated grief is that after the year period, you continue to have an intense yearning or longing for the person. And you can manifest this longing with dreams about them. And the dreams may take on the tone of wish fulfillment. An example would be dreaming that the person really didn't die and that the doctors got it wrong, or that their death was a dream, like a dream inside a dream. These longings can also be in the form of daydreaming, getting lost in thought about your experiences with the person, or imagining what life would be like if the person were still here. And these longings, whatever form they take, would be something that you would do almost every day. You can experience some of these things within the first year, but the usual is that these experiences would taper off. Another indication that you have a complicated grief picture is you continue to experience intense emotional pain like anger, blame, refusing to accept the death, an inability to have a positive mood at all, trouble engaging with people, or feeling emotionally numb, like you can't feel anything positive or negative. You may also do anything you can to avoid things that remind you of your loved one. If you're experiencing these things, you should consider seeing a professional for counseling. Grief support groups can also be helpful. Here are 4 things that can cause this to happen. 1 is guilt over a conflicted relationship. An example of this is losing a parent with whom you had a bad relationship. You may have even hated your parent because of the way that they raised you, and then once they die, you're racked with guilt about not feeling love for them. Your grief can also take on a different focus. Instead of missing the person, you grieve the loss of the relationship that you wish you had. And then that's the kind of thoughts that you have or that you ruminate about. Another cause is seeing someone die in a traumatic way. This can be seeing someone die in an accident, like falling off of a ladder in front of you. Or it can be seeing someone who has an illness that makes them very sick and in a lot of pain and suffering. And so while they're dying, you're in pain watching them suffer. And then after they die, you can't stop thinking about how much they suffered. A third reason is having separation anxiety before the loss. I talk about separation anxiety and how it can look in adults in this video. If you have separation anxiety or have had it and then it got better, losing someone can stir up the separation issues even more. Losing someone feels like you've lost a piece of yourself. A fourth reason is feeling like the death was an injustice. And this can happen with a crime or a preventable accident. And there's a lot of this going around now with losing loved ones to COVID. For some people, it stirs up feeling that their death was wrong and unnecessary. And that can generate a lot of anger with your grief that can then turn into bitterness. Grief is not the same as depression. But sometimes after a prolonged period of intense grief, people will slip into a depression. And it's not that easy to tell the difference between grief and depression, especially in the early phase, like the first few weeks to months. If you've been depressed before, you can always have another depressive episode at any time, and this would be called a relapse. A tragedy can trigger a relapse of your depression. So if you have a history of depression, you'll probably be able to tell the difference from the sadness you feel about the loss and how you felt when you were depressed. But you might not. If you start to become dysfunctional in most areas of your life and have physical symptoms like losing your appetite, having trouble thinking, it may be your depression returning on top of your grief. And in this case, you should see your doctor for depression treatment. The picture is different if you've never been depressed before. If you've never been depressed, you could become depressed within months of the loss, but you should still be slow to conclude that your intense negative emotions are depression. You should give it several weeks to maybe even a couple of months. And that's not a fixed time rule, but if you move too quickly to see a doctor for medication because you're still crying after 2 weeks, you may be disappointed to see that the depression medication doesn't help that much. Antidepressants treat an illness and take several weeks to work. They improve mood and other depression symptoms, but they don't erase sadness from a loss. You still have to heal from that. Healing from grief is a long, slow process, and what we think of as typical grief would be an experience that may start out intensely sad and negative, and then over time become less sad with more positive reflections on the person. For help on how to manage distressing emotions, watch this video on facing negative emotions. And to understand more about one of the reasons for complicated grief, watch this video on separation anxiety. Thanks for watching. See you next time.